Good evening. For this presentation, I chose to do Alzheimer's disease as my neuro project. I just have found that Alzheimer's disease is very uncurable and very common in our society, and I thought it would be great to just kind of highlight what it actually is because a lot of people get it confused with other forms of dementia, and some people don't know that it is uncurable. So let's get right into it. So, when diagnosing a patient with Alzheimer's, we obviously have like the basic like neurocognitive disabilities, but the criteria that we actually use to diagnose patients has come a long way since the original basis from 1984, and it was used to be merely based on the neurocognitive signs that I just talked about. But now we have so much more technology and scanning processes that actually help us know with certainty that people have Alzheimer's disease, and PET scans, withdrawal of CSF fluid through lumbar punctures, and even blood tests can help diagnose people with Alzheimer's disease. So it's really awesome that we have come such a long way with technology that we are able to do that. And I'm going to go further in depth with some treatment research later, but there's only currently two uh, classes of pharmacological therapies available to treat Alzheimer's disease, and while they are not fully curable, like I said earlier, it's not a curable disease, but we're working on it. They do help with memory and cardiovascular functions. I know that is a big benefit. I know in the long run, Alzheimer's disease still ends very sadly, um, but at least that helps. Now, for treatment, there has been a lot of research recently. Like I said, this is one of the most popular forms of dementia and one of the most studied diseases. So there is a lot of aspects that we research to treat this disease. Um, and I think the most beneficial thing that I found in all my research is what they targeted first, because there is so many aspects: memory loss, brain function, what the brain looks like throughout the disease, and just so many neurocognitive disabilities that they have to witness as a loved one. So I reviewed some articles, and I think that people need to know that they have Alzheimer's or that they have traits or early signs and symptoms way before they are ever diagnosed with it. I think that is something that we do not highlight enough, is that we need to start doing treatments sooner before they even start developing a lot of symptoms of Alzheimer's disease. And I think that if maybe we focus on that, maybe one day in the future there can be a cure for this disease. I mean, there's a new hypothesis every other day, it seems like, because this is so researched. And I mean, I know most of the times that the medications and everything don't show signs of improvement, and that even if they do, in the long run, it doesn't really pan out to work anyways. But there are so many different resources and pathologies and so many new technologies that we can use to find a cure and stop this disease or slow it down or halter it if we start targeting it so much earlier than we do now. All right, now let's go into the etiology. I think we all wonder really what factors and influences are for Alzheimer's disease. I know that when I was researching it, I wasn't really sure of anything except for older age, because you always see on television shows or really just in the media anywhere that people with Alzheimer's are just older people, and that's why they develop it. But actually, genetics, family history, and those with biomarkers and genetic predisposition for the disease are actually at a much higher risk for developing it, and you can get tests for this. So if someone in your family has Alzheimer's, or if you know someone like down the line of your family tree that had it, you are more susceptible to getting it. And while I mentioned earlier that age does play a role, sometimes there's early onset Alzheimer's and it can happen before your 60s, which is when it usually occurs. And it's just so crazy to think about. Alzheimer's affects the nervous system and has a wide variety of damage. So you can kind of see in my photo there, that's what the brain looks like, and I have another picture on another slide later showing what the brain looks like as Alzheimer's develops. And it's actually insane to see because our brain actually shrinks due to the nerve cell damage and loss of tissue and the effect on like memory and the hippocampus and all of that stuff. And Alzheimer's is an insidious disease. If you don't know what that means, it means it just gradually gets worse over time. It's not present at the beginning, which is why we need to get tested sooner, like I mentioned earlier. Okay, just like some signs and symptoms, like I've talked about a lot, memory loss, delayed recall of things, having delusions or hallucinations are very common. Most people don't really recognize people, or they think that someone's in the room that isn't. Many people with the disease also tend to have aggressive or disruptive behaviors because they are not always sure of what is exactly going on, or they are so confused that they are so aggressive. Cranial nerve abnormalities and gait abnormalities, these just tie into all the neurocognitive disabilities because those are parts of the brain, and I mean, gait, it just occurs with the condition because you cannot take care of yourself, honestly, and if you are noticing that there is an increased loss of like these functions and other systems of the body like also occurring with these symptoms, then that is a red flag that the disease is progressing and that there is going to be more issues in the future. All right, and some 5 patient education facts. Patients with Alzheimer's need to see a healthcare provider if they are trying medications to see if they have any effects or responses. Patients with Alzheimer's disease need to understand that there is no cure for it and it will eventually get to the worst point possible. Hopefully that won't be true soon. Patients with Alzheimer's disease need to understand that if they want to try and get better and get some functions they may have lost back, then they will have to be in clinical trials. That is just the sad reality. Since we have no cure, clinical trials are really the only way to try and find things that work to help with the disease and their symptoms. Patients with Alzheimer's disease need to realize that they may have depressive episodes when they are in the early stage of dementia. A lot of patients can't cope with the fact that they are going to lose a lot of their cognitive functions, so it is very common for them to be depressed. And patients with Alzheimer's disease need to have a support system around them, whether they remember them or not, to help them understand what is going on and get them through it. Kind of like I just said, depressive episodes are very common, so having a support system of people around you who understand and can take care of you is so important with this disease. Now some questions. When is the best time to find out if you have Alzheimer's or traits of it? A, when you start showing signs and symptoms. B, when you have people telling you that they think you have dementia. C, before you start showing any signs or symptoms. Or D, never. The answer is C, before you start showing signs or symptoms. If you get tested beforehand, then you'll be prepared if you have signs or symptoms in the future, and hopefully you can combat that depressive episodes. Okay, question 2, what are some ways we can currently test for Alzheimer's disease? A, PET scans, B, blood tests, C, CSF or lumbar puncture, or D, all of the above. The answer is D, all of the above. We can use all these tests to determine whether or not someone has Alzheimer's because we've come such a long way with technology. And question 3, which of the following does not affect having Alzheimer's? A, age, B, genetics, C, environment, or D, family history. The answer is C, environment. Well, I'm sure the environment could play a role. It's not one of the most common sources of Alzheimer's found when we do research on it, so it just really isn't relevant to the question. And here are my sources. Thank you so much for listening about my topic of Alzheimer's. I hope you have gained a better understanding and got some good use out of it. Thank you.